Here's a 360. My area. I'm gonna set up the camera. All right. I'm now gonna walk in the room, provide privacy, do hand hygiene, and then clean my stethoscope with alcohol. My name is Kyra Brown. I am your student nurse, and I'm going to be performing a head to toe assessment on you. Is that okay with you? Okay. Can I confirm your name and date of birth?
Naquan Williams, 07/31/05.
Okay. Do you know where you are and around what time it is today?
Yeah, I'm at home. It's about 9 p.m.
Okay. I'm going to say your appearance is well groomed, your body vitals are on a medium stature, your speech is clear and understandable, and their mood is present. I'm going to ask you some subjective data about your cardiac. So do you have any shortness of breath?
No.
Any chest pain or tightness?
No.
How many pills do you sleep with at night? One? Okay. I'm going to move on to objective data. And so I'm going to inspect the 5 cardiac areas, starting with the aortic, second intercostal space. We'll move on to the pulmonomic, second intercostal space. Move on to the Erb's point, which is the 3rd intercostal space. And then the tricuspid, which is the 5th intercostal space. And then lastly is the mitral intercostal space, which is another 5th one. Now I'm going to know that there's no lifts or heaves, and I'm going to palpate the 5 cardiac areas for thrills or pulsations. Again, starting with the aortic. We're going to move on to the pulmonomic. Now we're going to move on to Erb's point. And now we're going to do the tricuspid. Now we're going to move on to mitral. Okay. None of that noted. Now I'm going to osculate using the diaphragm. Starting with the aortic, pulmonomic, Erb's point, tricuspid, mitral. Note the S1 and S2 are present. I would do the same thing with the bell. And Erb's point, mitral. And I would also measure the apical rate for about like 60 seconds and note that I got around like a 74 for that. Okay, and then after we get done with that, we're gonna move on to peripheral vascular area. Do you have any leg pains or cramps?
No.
Any skin changes in your legs or arms?
No.
Any sores on your arms or legs?
No.
Okay, thank you. And now I'm going to have you sit at a 30-degree angle, and I'm going to inspect for some JVD, and I'm checking, and then there is no JVD noted. Okay, now I'm going to palpate your cardiac pulse. I'm using two fingers on both, and then doing it on both sides, doing one side at a time. And then I would osculate for Brewitt. Can you hold your breath? And I would use both sides of the bell, doing the diaphragm, and then I would use the bell. Okay. Now I'm going to palpate your pulses bilaterally, starting with the radial. I move on to the ulnar. Go to the brachial, then I move on to the popliteal, and I'm going to posterior-tibialis, and I do the dorsal pediis. I'm going to note that all pulses were 2+ and present. Okay, after that, I'm going to palpate all of your fingers for capillary refill. All 10 of your fingers. And then I would do all 10 of the toes too, capillary refill. And then I would know that all the color came back within less than 3 seconds. Now I'm going to assess the lower extremity for temperature using the dorsal side of my hands. And I would note that the skin dry. And I would test for edema within the lower extremities using the pads of my fingers, starting with the shins, holding for 5 seconds. And I'd move on to the ankles for 5 seconds. And then I would press and hold on the top of each foot for 5 seconds. We move on to subjective questions. So we throw out some lungs now. So do you have any shortness of breath? Do you smoke cigarettes or vape? Okay, and then do you have any pain while you breathe?
No.
Okay, thank you. I'm going to make sure that you're sitting up at a 90-degree angle. Thank you. I'm going to palpate the chest area for tenderness, keratitis, and then can you say tap for tactical for minus? Can you say 99 for me?
99.
Okay.
I know.
Thank you. And I'm going to percuss the interior chest area, tenderness. And I do 4 areas on each side. And say that there's resonance. And I would also osculate. Can you take slow deep breaths for me? And I would do the same for, make sure I'm going 8 areas. And now I'm going to, can you stand up? I'm going to do posterior, chest area. I'm going to inspect for bulging contractions. I'd say posture is symmetrical. The skin colors consistent with the genetic background, and the posterior anterior radius to the 1. I'm going to palpate for tenderness and keratitis. And then we're going to do tactical for Madison again. So can you say 99?
99.
Okay. Thank you. Thank you so much. Now, can you exhale for me? Inhale and exhale. I'm going to note that the patient expansion is symmetrical bilaterally, and I'm going to percuss the posterior lungs. Each area, each side, and note that there's resonance. And now I'm going to osculate your upper interior chest. Okay, can you take slow deep breaths for me? I'm listening to 8 areas. And after I do that, I would note that respirations are clear, labored, and regular. And then I would measure the respiratory rate for at least 30 seconds. Okay, we're gonna move on to the abdomen. When was your last bowel movement?
About 5 minutes ago.
Okay, do you have any changes of appetite?
No.
Do you have any difficulty swallowing?
No.
Okay, thank you. Can you lay down at a 0-degree angle, please, on your bed? Thank you. So I'm going to inspect the abdomen now and note that the abdomen is symmetrical. The skin color is consistent with genetic background, and there is no lesions. Your contour is flat and rounded. Your umbilicus is in the midline, and your umbilical hernia. I'm going to osculate your abdomen and listen to bowel sounds in all 4 quadrants using the bell side of my stethoscope. Also listening through it. Now I'm going to percuss your abdomen in 8 areas or quadrants doing the zigzag motion. Dullness, and I'm also going to palpate your abdomen in the same 8 areas. And I would note if there was any masses or tenderness or organomegaly And if there's not any, that's fine. But that is my head to toe assessment. Thank you for your time. I would make sure that my patient has their call light, their table tray, and their bed is back positioned to where it needs to be. And that's all. Thank you for your time. Have a great day.